There's social workers at the hospital, like everyone kind of has varying responsibilities. So just very quickly at the police department, we do a lot of stuff. So it's kind of hard to like summarize it. I think the takeaway is obviously we're there for crises, right? Police are usually involved with crises. We're there to assess and evaluate people, refer them on for other services. That might be after a police contact, as I was kind of mentioning. That might be prior to a police contact. Anyone can call us up any day. You don't have to have a police contact to use us. That could be during a police contact. So that could either be on a 911 call. That could be an officer calling us out because they want social services involved in what they're dealing with. So we're used in a lot of points during interaction that you may have with police. We are all master's level clinicians, meaning we are able to do therapy with people technically. However, we always refer out for that. So we're in a very resource-rich area. As you saw, Fox Valley Institute, there are countless and dozens and dozens and dozens of clinical resources in our area. So we just understand the fact that there's almost 200,000 people in this town, that there's 4 of us, and we just don't have the time. That's not our role to do ongoing counseling. So we always refer out. So we have an amazing system that we use where I take your insurance, I look up kind of what you're looking for. So if it's a domestic violence issue, if it's a trauma issue, if you're concerned about, I really want to see someone that specializes in LGBTQ, we kind of stratify our results based on that, and I provide referrals for those issues. However, because we are independently licensed with the state of Illinois, we maintain all of the license regulations with the state, meaning confidentiality. So you speak to a police officer, they have a body cam, we do not. You speak to us, we could speak privately in a room without a police officer present. You can tell me confidential information that I cannot document. You could say, hey, I want to tell you this and I don't want anyone else to know. And that's completely fine. Right, so any clinician kind of carries that confidentiality component, even if you're not ongoingly treating somebody. And so we take that obviously very seriously because that's my license at the end of the day, right? I have to kind of take that very seriously separately from the police department. So you can always have a confidential conversation. You can call us up and say, I want to talk something through. And that will never be documented, that will never be told to a police officer, that won't even be told to my boss, who's a sergeant, by the way, not a clinician. So although we don't provide ongoing counseling, we can have those conversations. I can't tell you how many times I talk to people on the phone and I never meet them. So they'll call me up and they'll say, my son is struggling with mental health issues, he's 34, what are my options? And we'll have a 30-minute conversation, we'll run through what's going on, I'll kind of break down the options and resources, and I'll say, call me again if you need me, and then I never hear from them again. So that can kind of be what that looks like as well. We do assist police, as I said, with death notifications. Death notification is obviously when someone either in town passes away or when the survivor and the survivors are in in Naperville, or if there's a death outside of Naperville and we have somebody nearby who we need to go tell. So that's an officer going to the door saying, I'm so sorry to inform you that your family member has passed away. We assist with those to kind of be that emotional support. We do assist with domestic violence. That is a huge component of our job. We're going to talk a lot about stats for different types of things. DV is the #1 stat for any type of call, more than mental health. So as Detective Stock mentioned, Chief Aries said we responded to over 1,000 mental health calls in a year, which there's 365 days in a year. So that's 3 a day. We do even more domestic violence. All of us are certified domestic violence professionals, so that means we have specialty training in domestic violence, have passed a test, and can say that we are certified to provide that service. A lot of us have worked with specifically domestic violence in the past. I used to be an abuse and neglect investigator, like various capacities like that. We are very confident in our ability to assist victims with those things. Again, provide resources, assist with court advocacy, explain what happens. If you have a child who experienced a violent crime, we could meet with them one-on-one before they meet with a detective just to explain what they can expect. So our role is never to be a police officer. It's never to interview them. It's never to ask them questions. It's never to provide evidence or collect evidence. But we want to kind of help that victim walk through that informed experience, if that kind of makes sense, at whatever they want, right? It's up to them. We do provide training to the police department. We provide support to the police officers for mental health needs for themselves. They obviously go through a great deal. We have a peer support team that is involved with mostly officers, some other various roles within our police department, but all 4 clinicians are available to them as well. And obviously our services are free, so that's kind of a perk for people. All right, so just kind of mentioned before we had started, police social services has been around since about, in this area, the 1970s. Naperville has had it for a long time. A lot of people in Naperville don't even know we exist, so spread the word. Again, because we work for the city, so you don't have to have a police or criminal issue to use us, right? But there are a lot of other departments, and many departments who are hiring more police social workers. So what does my interaction look like with youth? So I will tell you, I'm a very transparent person, and I will tell you I work with many teenagers, not majority, but many teenagers who have, I don't ever work with parents. That could be because they're afraid of their parents. That could be because their parents are absent. They don't have great parents. That could be because the parents are arrested. That could be because the parents are not a fan of social services. They're not really an advocate in the mental health area. But anyone over the age of 13 by law has access to mental health services with or without parental consent. And because I carry that independent license, right, we have that ability to meet one-on-one with kids. So what that means is you're all here because you care. I don't foresee that being an issue with you. But I am able to meet with kids in need for reasons, right? That's an ability they have. And we're very fortunate to be able to do that because a lot of these kids do have high needs. So again, we can meet with kids independently. We can, for a lot of things, but mostly what I work with teenagers is going to be after a domestic violence incident. So it's going to be after inter-partner violence. So them and their boyfriend, girlfriend have a cyberbullying issue. They have a sextortion issue. They have a verbal domestic at school, bullying issue at school, things like that. And then our school resource officer gets involved. After their involvement or during their involvement, it's referred on to us to make sure that they have all the resources that they need. We do work with school social workers. Again, principals, teachers will call us. They'll kind of work through cases if there's that release of information. But it just depends on what the issue is. So if it's a mental health issue, I'm going to always want to try to talk to parents. I'm going to try to get them involved. You're with your kids every single day. I'm not. You're the expert of your kids. I'm not. So my first call is always going to be to the parent. That phone call can tell a lot. But that is always my first phone call, unless there's a safety issue. We obviously refer to outside counseling agencies. We are a huge advocate for parents to get mental health services for their kids. We will assist them with what agency is appropriate based on insurance and need. We respond to those CIT, crisis intervention situations on 911 calls. So if there's a 911 call involving a youth, and a social worker is on the road, which we'll talk about, we will absolutely do our best to attach ourselves to that call. We obviously care about youth. That's one of our fortes, but also we just think that they deserve that. And maybe we're not used at all, and that's totally fine. I'd rather be turned away than not be there and be needed. I guess I don't know because no one tells me that.
Then maybe not.
What I will say is I think that people don't know, first of all, that we exist. A lot of people don't know we exist. And so I think they don't know that they can call us. Usually we exist after there's a crisis. And so by that point, they don't really have an option because there's a 911 call. You know what I mean? Usually if it's a referral from a school, kids are really cool about it because they're used to a police officer being in their school, and kids are pretty resilient about most things. They don't really feel those pre-existing kind of connotations that adults do. I think adults definitely have a little bit more of a wariness about police social services just because they don't understand it. It's still a developing field, and I think a lot of adults, it wasn't around when they were growing up, and I think that it was around when I was growing up because I got help from a police social worker, and that's why I wanted to do this job. But I think a lot of my friends still don't know that, you know what I mean? Like, it's just kind of an awareness thing. It's just kind of dependent. And I think, again, that's kind of a great segue. When it comes to parents, we so heavily rely on you guys. So when there's issues with youth, again, you are my biggest advocate. You're who I'm asking questions about. You're who I'm getting intel from. You're who we're working together. Because it's not about me. It's about empowering you because you're the expert of your own life. So with parents, when it comes to youth mental health issues, if it's at the point of police being involved, there's probably a problem. So we're going to be explaining what that looks like if police respond. What does an involuntary petition look like? What does a hospitalization look like? What's the difference between being taken to the hospital versus being admitted? What's the difference between different levels of care? We're going to be just explaining those things for parents who haven't been through it. I think a lot of parents, they just don't know what they don't know. And so we're just kind of explaining it so that they can kind of break down that barrier. They're afraid to call 911. They're afraid to have that police response, and that makes total sense to me because I wouldn't want police officers in my home if I didn't need to either, especially when it comes to medical information. That's just, we all feel very privately, right, about our lives, police included. So it's kind of explaining, number one, how common it is. Like, don't feel weird, this happens 3 times a day, at least, right? But then also, like, hey, we have multiple options and resources, and this is exactly what it can look like. So that's kind of a lot of my phone calls is just explaining. Safety planning for mental health crises, explaining what 988 is, explaining, yes, you absolutely should be getting involved if you're hearing these types of things. Yes, you absolutely should be taking that threat seriously, that kind of thing. Connecting to resources, again, professionals, people that specialize in areas of what your kid is experiencing. For domestic violence, if there's violence within the home, that is a huge thing of what we do. So a lot of times it's one parent is being violent, there's an order of protection between parents, one parent is trying to take kids out of the state, like various issues like that. So we'll kind of work through those issues with parents. We'll answer phone calls from one parent as we're getting info from the other. And it's not to get involved in family drama, it's to avoid those 911 calls, right? It's to make sure that everyone has the information so that you can make your best decision. It's to make sure that kids are safe, really. Obviously, we're calling DCFS because we're mandated reporters if that's needed. We're working with them. We're helping interview kids if needed so that they feel safe because they have a social worker.
That's a really good point to bring up just real quick. So just so you understand, like, we are mandated reporters, and obviously people in the school are mandated reporters too. So if you call for us and we come, like, if you tell me something, I am obligated to report that. So I had an incident many years ago with a school staff individual who told me something, and I said, did you call DCFS? And that individual said, no, it's going to screw up our interaction with the family. And I said, I have to call. You've told me, I can't, I'm sorry, like, we have to do this. And it caused some tension and strife, but so just like Allie sort of says on some levels, so the DCFS stuff is obviously for all of us across the board, but one of the things I think that really needs to be hit home with this is that she is not a police officer like me. I refer them all the time. I cannot express how great they are. And for all kinds of calls. I get people that, report online harassment that it doesn't exist. They have delusions. I have to go to Allie and them and say, I can't help this person. I need you guys to help. Or, with these kids that have issues and stuff like that. So just to kind of hit on that real quick, but with her is that they are fantastic. And they are, think of them like a clinician. I know she's in her vest and we're going to talk about all that, but really they have these resources and these abilities to give you guys so much more information than we ever do. When I started, we had 2, and this was in like 2001, and I could kind of call them, but you're speaking about some, hey, what happens at a traffic stop? They've brought in so much wealth of training to us that now if you say, hey, my kid's autistic, I feel very confident that our officers are trained, not to the level of Allie, but we're trained with basic knowledge. What was one of the things I said to you? Lights can be an overstimulation, right? When I started 20 years ago, people didn't know that. We didn't know that. We didn't know that, loud noises could be overstimulating. So, you get the average police response. We're responding to a crisis. We're responding to somebody that we see you on your worst day. We don't see you on your best. You don't call us in general to say, hey, we're having a birthday party, but you can. Just so you know, if you ever want, you can call us and say, my kid's having a 16-year-old birthday party. Can you show up anyways? And we'll show up with the squad car and put it out there and put the lights on, let you guys crawl through the cars and stuff. We're happy to do that. I've done it many times when I was on the road. But,
Black parties.
When we first started, everything we went to, there wasn't the mental health component. We weren't trained to that because it wasn't what we saw. So when we saw a crisis situation, I come in, I need to control this situation. I've got a child out of control. Parent says, control my child. And that's kind of how we dealt with it. But now with the training, now with everything they've brought into us, CIT training, being there for them as a resource, just being able to go and say, hey, this is what happened. I talked to Allie. I abuse them constantly. I feel bad. I probably take half my cases to them in the end. For one reason or another, they taught us these things. So when I come into your home and you say, my child is autistic, we're having a crisis moment, I now have some tools instead of to say, okay, hey, Joe or John, is it okay? Can I stay here? Is it cool if I stay here and you stay there? Is this okay? Do you want me to turn the lights off? Because we can deal with that. You know what I mean? So they make it really, really, really much easier. But just to highlight what they are, I mean, they are different from us, very different from us. They're a fantastic resource. They are clinicians. Yes, I will speak to Naperville. I cannot speak to anybody else. We're all CIT certified now, various levels. But I mean, even there's a difference. There's a change. I mean, we have learned over time, and I think Allie's going to hit on all these points. I hate speaking for her because she's like.
No, in Aurora, do you live in Naperville or Aurora?
Naperville.
Okay, so Naperville, Aurora, I can say their officers, a lot of them are CIT trained. They have a program we're going to talk about that's similar to one in Naperville. So they have, I can't speak to everything, but I know their police department definitely has a lot of programs that are a lot of progressively minded in the sense of special needs, social services, mental health, things like that. Last part about how we work with parents is for family crises. So again, there's not a criminal issue, but you have a major death. Structure fires is one of my biggest passions. My grandpa's house burned down when I was a kid. It affected my family greatly. I did not understand how much that affects a family until then. And so now every single structure fire, if I'm on the road, I attach myself to provide resources. I keep up with families for years because it takes them that long to get back in their home. So those types of, devastation, police officers clear the scene, they go to the next emergency. You don't clear that scene. That's your life. I can keep working with you. They can't. So it's just kind of that difference. Mm-hmm. You'd be shocked at the things I attach myself to, just because I'm I know, there's just so many things I can't, there's just so many random things. Structure fires, the
the
dogs
tornadoes,
go.
probably, you guys, I'm sure, were
Oh, the tornado, we were heavily involved.
2021.
Dogs go missing, and I'm if there's a kid in that home, that's traumatizing to that kid. You know what I mean? There's just so many things that I'm I put myself in that perspective, and I'm I would like a social worker, and maybe they don't want me, and then I go away. I don't care. You know what I mean? But what were you gonna say?
CTI, what is CTI?
CIT, Crisis Intervention Team. So it's a state training. This is not a Naperville thing. CIT, it's actually it's national, but CIT International is a 40-hour training that is for law enforcement officers, so it has nothing to do with me. And that was started aside from police social services to give law enforcement officers a more in-depth training as it pertains to mental health, elderly, autism, specific medications, although sometimes officers forget that, but I think the more and more they interact with things, they kind of start to remember. And resources, just kind of basic stuff, but it's 40 hours, the whole week, right? So they go off the road, they go to a specific classroom, they learn de-escalation tactics, they kind of get a rundown of these types of specific issues so that when they encounter them, because they do, they have a little bit more training.
We do scenario-based training too with all that, so they bring in people that, we run through, and then it's great, we get feedback, you'll watch
Yeah, they
each
get
other's-
graded
yeah,
basically,
yeah.
hey, try this differently. And then kind of when it started, they were we're going to do a certain set of officers that we think would be really great at it. And now Chief Aries says, nope, 100% of our officers are going, which is actually, that's a big deal. Because we have, almost 200 sworn? That's a lot of people, right? So just some stats, just again to prove that these are very, very regular situations for us. You will not be weird for calling 911 for these issues. You know what I mean? It's very, very normal for us. So in 2020, there was 870 total mental health calls. A mental health call can be a lot of things, but it has to be mental health related in nature. Crisis, suicide attempts, suicide ideation, I'm feeling very, very sad. Just a lot of things, right? But that person's calling 911 for police because of that. Okay, in 2021, during the pandemic, no surprise, we saw almost 1,000. We did see a decrease in suicide attempts. And then in 2022, we saw a little bit of a decrease in mental health calls, but we saw an increase in suicide deaths, so completions. And then I did want to make a note that the teen suicide deaths, I hate to talk about this, but I know that's why we're here, right, because of adolescence. In 2019, there was 2 teen suicide completions of Naperville children. 2020, 2021, and 2022, there was 1. And those are Naperville children, not kids that came into Naperville to end their life. Drug overdose. So red is prescription, this middle yellow is heroin specific, and then fatalities is the smallest percentage. I'll just kind of let that sink in. So pills. So like
Vicodin,
people are
yeah.
finding them either in their home or they are taking their own prescription medications. So not even just, again, not just the own ones that they're prescribed, but kids are finding them in cabinets. And that's kind of something we haven't touched on. There wasn't time in the main presentation, but please lock up your medications. If you have an adolescent with mental health issues, even if you're unsure, if you're kind of feeling those risk concerns, there's no harm in doing that. Like it's not gonna, it's 10 more seconds to unlock it. You would be shocked. I even see kids selling them now just for income. Even though they're not ingesting them, they're selling them. Kids don't even care what they're taking. They're like, oh, cool, pills, shiny object. Like, they don't even care about the effects of it or what they're taking. It's just something fun to do. So please, please be smart about your meds.
Another quick note on that is that we do have a drop-off box in the front lobby of the police department, so any of your old prescriptions you can drop off and throw in that box, and the fire department comes, picks it up, and they get rid of it.
So I asked Intel to kind of pull the correlation between, okay, how much of these overdoses are youth though? And then how much of that is an attempt to actually end their life? So again, we talked about recreational use of drugs versus I'm actually trying to end my life. It's a little bit small, but I wanted to kind of emphasize that this is only for youth data for 2020 to 20, she even pulled 2023. So far this year, I'm proud to say that we only have had 1 youth overdose, and that was for the purpose of attempting suicide. It was not completed. 2020, we had the most, probably because kids were at home, they had access to these medications the most, they were stressed, they were bored, right, all those things. 6 of those were attempts to end their life, 7 were unknown reason. 21, we had 8 suicide attempts, 1 was accidental and 1 was just to get high. In 2022, we had only 6 and 4 were attempts to end their life and 2 were unknown reasons. Is this shocking to anyone? And this is not counting any students, or this is not counting Aurora stats at home, but if it happened at a Naperville school and they live in Aurora, that would still be a Naperville stat. Does that make sense? So if the schools, this is for anything that happened inside of Naperville. So if it happened at Matea or even Nequa, but they live in Aurora, this would still be a part of the stat because it happened in Naperville, right? All right, last one is domestics. As you can see, it's more than any other type of call. 2020 was a very, very dangerous time for people. Very, very dangerous time for victims. We were very concerned about this as a profession. People are at home with their abusers all day long. They're not in front of people. No one's seeing their wounds. No one's seeing their signs and symptoms. It was a very concerning time. Luckily, things are going down. But again, it's still always our most common call. This could be a verbal domestic, so believe it or not, we do go to, I guess, arguments between people, right? Those can escalate, of course, anytime, and sometimes they can be a sign of things that are going on more than that. So police will respond to those things. A lot of times I follow up on a verbal domestic, and I do get more out of that situation that I can help with. So family issues, concerns from a parent about mental health or about substance use, things like that. So it's just kind of a point of contact for us, and we still follow up on verbal domestics, even though at the end of the day, that's an argument, right? But it could mean more.
Yeah,
We get well-being check calls all the time by third parties. Again, people are allowed to argue. That's not a crime. People are allowed to fight with their partner. But if you use your judgment, right? If you think that it's something that isn't normal to be happening in public and you just kind of get that icky feeling, there's no harm in us being called, and then it ends up being nothing. All right, so reason why I'm wearing this vest today, we talked about what crisis intervention team is, CIT. So again, that was police only. That was them getting that 40-hour training. Existed before police social services became a hot topic in the last few years. Naperville PD, during 2021, created what's called mobile CIT, so the Mobile Crisis Intervention Team, in which law enforcement and clinicians, so one of us four, are riding in a squad car during the hours of noon to 10 p.m. during our peak call volume of these types of crisis calls based on data to respond to calls with police officers. So kind of more of in a first responder role. This is just a 3-minute video that I can never say this, TV17 did. So I wear a vest solely because anything can happen anytime. We ride in a marked squad car, never an unmarked, unless there's absolutely no cars in the road, but normally it's a marked squad car, meaning, obviously there's connotations about police that have nothing to do with necessarily social services, but I'm with a police officer, and anything can happen anytime. Theresa can speak more about that than I feel comfortable, but this is for the worst case scenario. On my Molly is about 75% social service stuff, and then 25% worst case scenario. So I have a tourniquet and gauze and stuff like that, some of which I have used actually on the tornado site. There was a guy with a head injury. I have a flashlight, I have a radio that I respond to and listen to all the time. But then I have kind of my first aid kit and my first responder tools as a social worker. So I have added some fidget toys that I use for cases with autism and ADHD. I've talked kids literally off a ledge by using my fidget toys, besides my words, right? I have fidget spinners. I have, what do I have? I have a notepad of picture cards, so if I'm dealing with someone who's nonverbal, they can point out and communicate to me still. Our fire department is working on an initiative, ma'am, and I want you to know this, that in Naperville that they're carrying calming kits that include sensory items, weighted blankets, things like that, so that they will immediately, there's going to be 3 in the city, north, middle, south zone, that medic would attach themselves if there's a call with autism to be able to bring that sensory kit and be useful. That's extremely awesome and extremely progressive that not many fire departments or police departments have. They're not cheap, they're not easy to get, and it's worked. I was on a call with autism. It was a horrific call, and it was just a sad situation. He was very escalated, nonverbal, speaks only Korean. It was just very hard for police and fire, and that calming kit worked really well.
We respond to right around 1,000 mental health calls per year. It's actually one of our highest calls for service that we have to respond to on a daily basis.
As mental health crises have become a significant portion of the calls coming into the Naperville Police Department, officers say the department is taking additional steps to help these people in times of need. While they've had in-house social workers for years, this is the first year now that the NPD is dispatching out these clinicians with officers.
With the clinician there on scene, they can immediately start providing that support and immediately start finding resources for them. And what it also does, that's very important, is it sends the message to that individual and that family that a social worker and a counselor is on the exact same page as that officer with the end goal of helping that person in crisis.
While some officers are trained to be on the Crisis Intervention Team, or CIT, there's only so much they can do. That's where the mobile clinicians come in.
Because I'm not a police officer, I have more freedom to follow up with those families and individuals. So I'm able to say, to someone I can call and say, hey, I was the social worker that came to your house yesterday. How are things going for you today? And how can we make things better for you tomorrow?
There's many individuals that are in a mental health crisis where the uniform can actually antagonize the situation or make it more difficult for us to make a connection with them.
Known as the Mobile Crisis Intervention Team, this program started as a pilot last year with clinicians joining school resource officers in the summer while school is out.
And it was hugely helpful, hugely successful. We were able to respond to a lot of different needs, help a lot of different people.
The NPD expanded Mobile CIT to their patrol unit and has made it an official full-time program as of this year. Police Chief Jason Eries commends the bravery of these clinicians.
Someone in crisis can go from 0 to 100 very quickly. It may start out as a non-violent call and it can go violent extremely quickly, and no one knows better than those 4 individuals. So I don't think enough can be said for their willingness to put themselves out there for those residents in this community to help them or a family member through a very difficult situation.
Chief Eries is now also requiring that every officer in the department achieve 40 hours of crisis intervention team training.
Now, I'm not naive to think that people have not had bad experiences with officers. Not only our department, but departments across the country are recognizing that we can do more on these calls. We can be more human, as I describe it, because everybody's been through crisis, and we want to make sure that we can relate to these people and help them to the best of our ability.
Getting that training, along with having a licensed clinician by their side when necessary, are both measures officers across the department hope will lead to a better, safer community. I'm Kevin Maychek for Naperville News 17.
Just to go along on the police training end of it, the officer saw in there, Kevin Fasana, he's very active in like mental health training. He was on NAMI's board, I think, for a period of time, if you guys are familiar with NAMI. And now Kevin's actually one of our training officers. So like even like quarterly, we do quarterly in-house training. We have 2 days of quarterly in-house training. That's separate from like anything I do outside or the CIT. And so like these types of scenarios, like they create scenarios basically off of calls that we have many times for us to train to. So like, you know, you may get something that, you know, Allie can come back with a call and said, hey, you know, like we went to this type of call. Either the officer did really, really well on it. It was a mental health call, or maybe there was some stuff we could have done better. And if it's really great, we want everybody to do great and see like this is a call that could have gone bad that we could do, you know, we want to make sure we train to. So this type of training for like CIT and stuff like that is ongoing in our department. We're constantly trying to make sure we get the experience and exposure for our officers to make sure that maybe you don't get to experience that call, but you've done it in a training class and now you have some tools and some ideas, especially if you don't have them as a resource.
Mm-hmm. Yeah, and I think like we say that, you know, not to toot our own horn, like we have perspective because we worked with other departments all the time on cases, and I come from different levels of you know, the state and the county and stuff like that, and I've worked with many PDs, and I see how people do things, and I stay here for a reason, and I want you as citizens and as taxpayers to know that, and I want you to spread that word, that I don't have to say this, but I want to, that I really do believe in the way we do things, and I think we're very progressive thinking when it comes to how we can be better and what truly works best for you. All right, so what can you do? This is about you, not us. So please don't be afraid to call 911. I work for police, and I can tell you I still get afraid to call 911. Those are hard numbers to dial. I get it. There's no like answer or trick for that. But just know that that is their jobs. They do that all day long, answering those phone calls. I can promise you, the things they've heard, you will never reach to the level of the things they've heard. So just call if you have any questions or needs. You want to call 911 though when there is an emergency for police, fire, or medical, meaning you will be endangered or your life and your property and your safety will be threatened if you don't call right now. The non-emergency number, which is 420-6666, is a 24/7 number that is for anything that's like already happened a few hours ago, anything you don't need someone to respond to right away, a well-being check. Hey, my neighbor, you know, their mail's kind of been piling up, and I just want someone to kind of go check on them. Things like that, you know, again, not an in-the-moment crisis, but I still would like a police officer or a firefighter, paramedic to maybe eventually check this out. You always just want to remain calm. Again, they know exactly what to do. They know exactly how to ask you questions. They're going to ask you all the right questions, and you're going to know exactly what to say. Just remain calm. Follow their questions and their prompts. Don't hang up until they say so. It's very hard for them to relay information to their first responders if you hang up and if they don't have enough info. The police officer, because I listen to the radio all the time, and I'm in these situations now. You know, we want to know things like, is the caller on scene? Is mom on scene? Is she coming from home? Is she coming from work? Like, we're going to have questions, right? For not only our safety, but to better help you right when we get there. So stay on the phone, because the dispatcher might have more questions for you. If you work in a building, a setting, a school, even at home, I think it's good to have a safety plan and to know, okay, when police get here, this is how they're going to enter the home. This is where I'm going to keep a spare key in case I'm at work and they have to come in so my door doesn't get broken in. You know, just various safety plans, and teach that with your family. All right, so again, this is about you. I want you to walk away feeling like you know more things so that you don't have to call 911 unless it's absolutely necessary. So we're going to go over domestic violence and then a couple programs that the Naperville PD has, so we don't have to call 911 unless it's necessary. Domestic violence, again, is a really hard topic to talk about. It's something that we don't want to admit is happening. I think it's almost harder to admit than mental health at this point. I know it happens to everyone because I work with CEOs and then I work with the opposite, right? If you are uncomfortable reaching out to one of us, meaning me or my coworkers, or if you're uncomfortable reaching out to 911, that would not be uncommon. I don't want that to stop you from getting help. And I want you to share this with your children because I want them to help empower their friends. So you're going to advocate for your kids. That's why you're here. I'm not worried about your kids. But I want you to help encourage them as far as their friends. Detective Stock can definitely attest to the violence we see, even virtually, amongst youth, that can be very detrimental to their mental health. So if you are experiencing that, or if you know someone who's experiencing that, if you know a coworker or a sibling or a parent or a neighbor, please know that there are community resources that specialize in this all day, every day. There are hotlines, so if you live in DuPage County, you'd be working with Metropolitan Family Services and Family Shelter Services. They kind of merge, so it's one and the same. But they specialize in domestic violence, so they assist with all things DV, orders of protection, counseling, hotlines, things like that. That is their 24/7 number. If you're in Will County, that's going to be Guardian Angels or Groundwork. That's their 24/7 number. And then Mutual Ground is like their domestic violence portion of that. All right, Caring Hands and Fast Track. So these are two programs that are the City of Naperville. So this is for if you live in Naperville only, or if you spend like a lot of your time here. So if you work here, if your kid goes to school here, if you share custody, with somebody who lives in Naperville, things like that. They are completely free. They are for our police and our fire. So Caring Hands, does anyone know what Smart 911 is? Okay, Smart 911 is like an optional database for if a first responder comes out. So we have our own program and it's called Caring Hands. So Naperville has its own dispatch center, so we don't share with other cities. So what that means is that when Naperville Fire or Naperville Police goes out to a scene, all we have is what Naperville knows. So we don't share info with Aurora, we don't share info with Lyle. So please give us information if your child has special needs. Please let us know if they have autism. Please let us know if they have Down syndrome or if they have a serious mental illness, if they have something, if they're afraid of police, if there's something that requires a specialty response and more information that you as the parent would want police and fire to know. So it's just optional information you provide. It's not required. It's by no means, mandated, but it's a great resource so that way our dispatch center can relay information such as triggers, hooks, medications, emergency contacts info, warning signs, things like that. Like, hey, my kid loves talking about fire engines. Even if it's a police officer response, just talk to him about fire engines and he'll calm down. Things like that. It's really great for autism and it's really great for dementia patients if you have parents, things like that. Again, optional, you provide the information to us. It's completely confidential except with obviously emergency and first responders. And you just call the non-emergency number about these programs and we'll get you to the right person. But you can also contact me. I work very closely with both these programs. And then Fast Track is very specific for autism and dementia because these tend to be our populations that wander. So this is our tracking program. So if you have anyone in your life, or if you know anyone, if you know a neighbor, somebody who tends to wander, this is an optional tracking program. It is not a GPS monitor, so it's actually different technology, which is nice because then you don't have to worry about signals, you don't have to worry about batteries, but the person does have to commit to wearing either an ankle or a bracelet, which some people with sensory disorders don't like doing. So that's the one caveat. Again, completely optional, and you can pull out at any time.
I know years ago, before we even had all this stuff, I went to an autism training and Fast Track was there and they had told us, and I don't know what their statistics are now, but in the past they have said that like with our nonverbal people who wear these that wander and take off, that there was like a 99% ability to track that person now within the time range. So the technology, just to understand, it's based off a radio frequency, so we need a good starting point. So if you call us 3 hours later and it's been 3 hours since that, the probability is pretty small, but when it's a very close window, you have that child maybe or that parent who's just left and you're like, gosh, it's a 20-minute window. And especially if you have any sort of a like, maybe they would have gone that way. We know there's usually some directional kind of information we can get ahead of time. But we have very, very good ability to locate that individual. It's a waterproof, looks like a wristwatch. They wear it. We come out and change the batteries. We have a staff member that does that and changes those out rather regularly. We are not monitoring you 24/7 hours. It's not big government. I have no idea where you're at. You have to call me, and I have to be within like a mile radius usually to be able to use this device. So if there's privacy concerns, I think it's important to note that like that's not what this is for. I don't know where you're at, and we don't need to know where you're at. But it's for those crisis times where we need to find that child before something bad happens to them.
988 was talked about. It's the new suicide crisis prevention hotline. Just something to note, we will get transfers from them. So let's say like your kid is calling into 988. We got one just a couple weeks ago. We pinged them down to a school. They were inside of a school building, and they were telling the school district that, they were going to be ending they were telling 988 they were going to be ending their life, and then they ended the phone call. So if your kid ends up calling 988, great option. But then if 988 is concerned, they will call police. So what I say to parents is to tell your kids about the text line, because kids don't like talking on the phone. It's like not a thing for them anymore. Or to call 988 because it's a point of contact, but feel safe as parents knowing that if those trained professionals feel uneasy about the situation, they will call us, right? DuPage and Will County Health Department have their own crisis hotline. It's just another option. Those are all 24/7 numbers. I know it's kind of small. These are like additional support services for like kind of more of the outlier issues. Again, we as social services assist with all things, not just police issues. So homeless issues, food insecurities. I help people all the time with like how to find jobs, like things like that. Financial support. So we rely on a lot of these agencies in town because I can't do all this. I give information to people who can help them. But just know you live in a very resource-rich area, which is probably why you see some dollar signs on your tax bills, because there's a lot of stuff in our area. And that's really great because that's why we're in such an awesome community, and I really do feel that. These are all 4 of our information. This is just like our group email. So if you just have like a general inquiry, not a specific situation about your child, I would email just the team. But you can always reach out to me. Obviously, you've met me today with a phone call. I'd be happy to help, and I really mean that. I prioritize you guys as parents. You're the expert of your kids' lives. I take that very seriously. Yeah, I don't really have anything else to say about that because that's really kind of the end of that. But is there any questions? I've never gotten that question. It's definitely like, it's a little bit of pressure sometimes on us because we do have to find referrals for families in crisis like yesterday, or else you wouldn't be calling the police. So we rely heavily on our community partners. That's why I'm saying we really honestly thoroughly rely on the community. There are so many counseling agencies in this area. For youth, we primarily rely on Youth 360. They're an amazing agency. They take the uninsured and Medicaid patients, which a lot of people in town do not. They also come into to District 203 and will do counseling in the school, which is awesome. So it just depends on the situation. It depends on the need. Honestly, youth, I will find you an answer. It's not going to be I don't know, good luck, here's a list. I don't do that. It depends on insurance. It depends on a lot of things, but we will work together. And I tell parents, it might not be overnight. It's probably not going to be overnight. These problems have been months in the making. As you know, you live this every day. But there are a lot of resources, so we'll find somebody. But yeah, the reality is I can't control wait lists and that kind of sucks, but we live in a very resource-rich area, which is nice. So we'll keep calling until we can, or you can keep calling and then let me know, hey, I still haven't found someone, and I'll find you more resources.
That kind of jogs just a couple things that I think is probably helpful, because you're here to see what we do when we respond to police, and it is hard. So when you call us and it's a crisis moment, we are sort of stuck dealing with that person in that moment. And the thing that I said as we were walking in with some of the people here, Ryan and Christina, I said, I always enjoyed mental health calls because they're not bad people. So the people that are calling, they're not bad criminals. They're just a person who's having this horrible moment, and they're like, help me get out of this horrible moment. So the thing that you have to understand when you do call us is there's kind of a two-pronged thing. One is we want to help you, but two, there is the criminal component of stuff. So I want to be realistic with everybody here. We respond to these mental health calls, and our goal, all of us, is to get the moment under control, help the person to move on. Now, sometimes that doesn't happen. Sometimes by the time I get there, maybe you've been battered. Maybe you've been, something else has happened. There's been some sort of a criminal act. I can't always look away from that, and I think that needs to be realistic. But the thing I want you to understand is if we come and there's a criminal component and ultimately maybe it leads to an arrest, that does not mean the world has ended. Okay, that does not mean that the police are bad and we were there. That means that we had to make the best decision to control an environment, make everybody safe. And one of the things they have, like in DuPage County, is they do have the mental health court.
Yeah.
Now, granted, that's for adults. It's not children focused, but the point is that the criminal justice system is trying to expand and grow upon this. So, for example, like in mental health court, people with mental health problems who perhaps like commit some of these crimes can be placed into that court system so that they can kind of make some referrals. So sometimes a lot of it is compliance with medication. Okay, like if you're compliant with your medication, you're having a great day. And then when you become non-compliant is when that crisis starts. Or maybe you never got that treatment. So that courtroom environment can kind of sort of say, hey, you...
I think your next session starts soon, I think.
Oh gosh, I didn't know there was another one in here after us. So I'll wrap this up. But so there are other things out there that just so you understand, if we do have to come and we have to make a decision that you didn't like, don't let that say, hey, I'm never going to call the police again, I'm never going to reach out. If we have to do it, we have to do it. Follow up with us. Once everything's calmed down, it's a really great time we can talk, okay? An arrest doesn't mean everything's over, but sometimes to make everybody safe, we have to. And I think the other thing just to know too is like with these, type of suicidal calls, we come out, we assess, we talk to those individuals, and if they make statements that they want to harm themselves, we are required to petition and take them to Edward Hospital, okay?
Yeah.
With juveniles, it's a little bit different. You as a parent can make that choice. If you don't feel safe, if your child's in that kind of a crisis situation, call us. And a lot of times, honestly, they're not even that upset with us or the fire department. It's, honestly, you guys have that emotional, that's bringing it up. So it's easier for us to take that and help it out a little bit, yeah. And calms it down a lot. We can kind of talk to them. And just lastly, don't be afraid to invite the police into your school or into your home or wherever it might be if you have a child that has special needs. Because if we can meet that child and create some, relationship with them, it can make it a lot easier later on to deal with that situation. We are always happy to come out. You have a birthday party, like I said, a block party, your school, special needs class or whatever it might be, you can always ask for the beat officer to come out.
Thank you so
Okay?
much.
Yeah.
Thank you.